please, Senzo. Just to give you a brief background about Languni. Languni is an NPC, a nonprofit company, which aims to create a platform that enables the nation to find innovative solutions by contributing to creating a well-informed society for the future of Africa. So what we focus on is raising awareness on a variety of issues, such as science, technology, health, wellness, education, and so forth. And as part of Breast Cancer Awareness Month, we thought it would be great to have this session focusing on both prostate cancer and breast cancer. We have a fabulous panel today, but I won't be the one introducing them. I'd like to introduce Sarisha Govender, who will be our moderator for today. Sarisha Govender is a journalist. She's a South African multimedia journalist, a broadcaster, writer, documentary filmmaker, and science communication consultant. She's worked in more than 30 countries or 5 continents, producing content for multiple outlets, including the BBC, CNN Health, HuffingtonPost, and Good Magazine. She specializes in health, science, and gender issues in the developing world and reports extensively on public health emergencies, natural disasters, and the impact of climate change from the field. If I were to continue, I think I would take the whole day in introducing her. So Sarisha, take it away, and yeah, all the best. Thank you.
Great. Thank you, Rafilwe, and thank you for that glorious introduction. And thank you especially to Languni for hosting this conversation on such an important topic. As Rafilwe said, I'm Sarisha Govender. I won't go through my bio again. I don't think you need to hear it, but I'd really like to thank you all for joining us today, especially given the topical times we're in with COVID and all the impact of everything else happening in South Africa and Africa right now. It is so important to keep the focus on these important issues like breast cancer and prostate cancer. And particularly now we're doing this conversation during the month of October, which is Breast Cancer and Prostate Cancer Awareness Month. And we're going to be using this opportunity to engage in a dialogue with you, to raise awareness, to give you some facts and to give you some figures and to give you some resources that you could use. And we also have an awesome panelist of women to share their experiences with us, with you. So you don't feel alone and you have something to relate to. And you can see how people are coping with breast cancer and prostate cancer in the country today. In addition to those panelists, we also have Professor Shirley Motaung, who is a breast cancer and prostate cancer specialist. And she is an absolute wizard and will be taking you through the causes, as you can see, the causes, symptoms, and treatments for breast and prostate cancer. Prof. Shirley is a biomedical scientist and director of the Technology Transfer and Innovation at Durban University of Technology. We are so lucky to have her, and we're super happy to hear what she says later on. So just to take you very quickly through what's going to be happening, Prof. Shirley will give you a quick review of her session. Then we'll go into our panelists who'll share their stories, and we'll talk about the support available for you as well. And then we'll go into a Q&A session after that. So please, as Rafilwe has said, please either raise your hand or send us a message or your question or comment in the comment box on the side, and we'll get to it. So without wasting any more of your time, I'd love to jump into our first wonderful panelist, Professor Shirley Motaung. Thank you, Shirley.
Good evening, ladies. I hope also got gentlemen. I have to share my screen, and before, can the host allow me to share the screen, please? Together, I would love to share the screen because I have a PowerPoint presentation that I need to do.
Sure.
Yes. I need
Sensor, if you stop sharing your screen, then Prof. Shirley can share it.
Prof. Shirley, you should go ahead.
Okay. Which one do I start with? Can you all see it? Let me start with this.
Yes, we can, Prof. Shirley.
Okay. Let me just say, I'm going to talk about things that I don't have. I don't have a prostate, but I'm going to talk about it. I've got a breast, it's easy for me to talk about it. My topic or my talk for tonight is been divided into two parts, as you saw the program. And let me just also thank the presenters, and let me also thank the people that have been invited, and Laguni for partnering with Global Health Biotech. I really appreciate it so much. Without any waste of time, let me go straight to the point. Why are we here for? And I'm just going to go this quickly because everybody understands what is cancer and type of cancer. And particularly today, we're going to talk about the prostate and also breast cancer. That's my focus of my topic tonight. What I'm going to talk about and a little bit of the symptoms, risk factors for cancer, how we diagnose it, and the prevention measures, and how one can avoid and the new hope in cancer treatment. And if I just have to give a quick definition, what cancer is, if somebody wanted really to understand, is just nothing else, but it's a large group of diseases, over 200, characterized by uncontrolled growth and spread of abnormal cells. In the layman's term, if somebody asks you, what is actually cancer? You just say, cancer is actually nothing else, but it's just uncontrolled growth of abnormal cells in your body. And we use the term cancer, and then that to refer to most of these 200 different diseases. And those cells group together, they form a tissue or an organ, and then cancer can arise in those cells, kind of breast cancer cells, we've got stomachs and etc. If we want to talk about the prostate cancer now, which I also have to talk about it, and I'm passionate about it because my master's was actually on prostate cancer, where I developed a novel method to diagnose prostate cancer at an early stage, where we've got that diagnosis, and currently which one or the doctors end up missing diagnosis prostate cancer. Where that was how I came into prostate cancer. A cancer in the male prostate is just nothing else but a small walnut-sized gland that produces seminal fluid. And for those perhaps who was not aware what is happening, a male prostate produces the seminal fluid that nourishes and transports sperm. And some of the prostate cancer grows slowly, and some of these cases monitoring is recommended. And then we talk about a tumor, because sometimes people don't understand what is a tumor, what is a cancer. A tumor is nothing else but an abnormal mass of tissue which may be solid or fluid, and tumor doesn't mean cancer. Hence, you always have to understand whether is this a benign tumor or a malignant. A lot of people don't understand it, and it's very crucial to explain, because when somebody's got tumor, started panicking that he or she's got cancer. When we talk about benign tumor, these do not spread from the side, but can, squat surround the cells. And those ones, it's easy if we talk about at what stage, is self-limited in their growth, and it cannot metastasize, do not invade or metastasize, meaning that it cannot spread. And hence we'll say, what type, is this already spreading or not? And then we'll start talking about it. And malignant is now when it has already spread, can spread from original site and causes a secondary. So when usually they ask you the stages of cancer, it is crucial, because if it is benign or is on the stage 1, then they can, do chemo or do an operation actually to take it out, to take that cells out, or to operate it. But if it's already spread, that's why they will call it, it has already metastasized, then it becomes difficult for them to do the operation. So hence, it's very crucial for people to understand. Hence, most of the time you will see that they said to you, my cancer has spread, and there's nothing that they can do. Because if they can try to operate it, they're even going to cause it even more, so that it can metastasize. Why now? I want to, okay. I'm not going to go through all these types of cancer for the sake of time, but I'm just going to talk about, from one point of view, there are so many types of cancer, and there are different people, because everyone's genes are different. And so no two cancers are exactly alike. And this is what is crucial. Each and every cancer has got its own. And then from other point of view, there are also so many different types of cancer, and there are different types of women's cells, just over 200. You need to understand. Again, hence we talk about types of cancer, that they do differ and they are different. From another point of view, there are so many different types of cancer, and there are different types of immune cells, just over 200. I was just giving you that as an example. Now, this cancer, they can be grouped into different types so that the people must understand. We've got those ones that are carcinomas, and I've given you an example like lung, breast, and colon. Those are the carcinomas. And then we've got the one that we call it leukemias. And those are the cancers from the immature blood that grow in the bone marrow. And that's why they usually call it, you've got leukemia. And then we've got the one, the lymphomas. Lymphomas are cancers that arise from the lymph nodes and tissues of the immune system. And then we've got the one that we call it the sarcomas. I've given you an example there, and we've also called the other one that we call them the adenomas. So those are the different cancer that can be grouped in different types. Now, what really causes cancer? It really differs in terms of causes. Some, it can be a mutation, if one is going to talk about that. It arises from the mutation of and that and cells that are old or not functioning properly normally self-destruct are replaced by new ones. So those are the kind of things that end up actually causes cancer. However, cancerous cells do not self-destruct and continue to divide rapidly, producing millions of cells. Hence, they will start talking about it has spread. And in terms of prostate cancer, and this is where we've got challenges now, it is not very clear what causes prostate cancer. And prostate cancer begins when some cells in the prostate become abnormal. And because of our cultural belief, a lot of men, they don't want to believe that they've got prostate cancer, either if they are there in the rural areas, or even now, even if they are educated, they're thinking that they have been bewitched. You know, they don't understand that they've got serious prostate cancer, and that's at the end when they've been diagnosed, it's already late because it has already spread. Now, some of the things that I can just give it to you as a cause is carcinogenesis. Those are sometimes where they always make sure that when you work with X-ray, be careful because UV light, they can also cause cancer, as we call them carcinogenesis. And then chemicals, some chemicals, they can also cause cancer. Viruses can also cause cancer, hereditary predisposition, and some families are more susceptible of getting certain cancers. So these are one of the things that one has to be very, very take note of those kind of things. When I talk about the symptoms, again, it depends. But most of the common symptoms that people always have, you'll see that you end up having a change in a bowel habits or a bladder functions, mainly that will be either for the urinary and source that do not heal, and unusual bleeding or discharge that is usually happen for certain kind of cancer. For the breast, of course, they will look at the lumps or the thickening of breast or other parts of the body. And then another thing is indigestion or difficulty swallowing. And then recent change in word or mood and persistent coughing. So these are general things that you will constantly having all the symptoms, and you need to start consulting if you've got one of these symptoms, because that can be one of the things that needs to be taken care of quickly. In terms of the prostate cancer, how are they going to find, especially men? The major possible side effects of radical prostatectomy are urinary incontinence. In a male, they are unable to control urine, and that is one of the symptoms for prostate cancer. Then other symptoms that they need to be very careful is that erectile dysfunction, problem getting or keeping erection, and can also occur with other forms of prostate cancer. On the other side, in terms of men, burning or pain during urination, or difficulty in urinating, or trouble starting and stopping while urinating, or more frequent urges to urinate at night, but sometimes there's no symptoms at all. And why I'm saying sometimes they don't have the symptoms at all is because of the type of the method which I'll talk to you about, that it cannot even detect it at an early stage. And on the other hand, men must just be very careful when they go and urinate. They need to look at the force of that urine. How hard is that urine to hit the wall? That is also one of the things. But if their urine is not so hard and cannot really hit the wall, that becomes a problem as well. It's a pity we are doing this. If I was going to show what do I mean in terms of that. But for men, they understand when they go and urinate that wall, that they need now to make sure that their urine comes strong a bit. And in terms of risk factors is anything that increases a person's chance of getting disease. Some risk factors can be changed and others cannot, and different cancers have different risk factors. And I'm just, for the sake of time, I'm just going to summarize this quickly, because we are fully aware of the lifetime risk factor. Smoking and obesity, it can also be factors that can also be associated with cancer, certain cancer in terms of that. And then the biological factor, some cancers such as breast, stomach, colon, prostate, and ovaries and lung appear to run in the family, as we'll talk about the biological factor. And if you know that your mother, your father has had cancer, that's why it is very crucial for you as a person to keep on checking yourself. And Hodgkin diseases and certain leukemias also show similar patterns. And research suggests that a gene for breast cancer exists, which was a P10. This was actually something that was also new when people were busy doing research in terms of cancer. And occupational and environmental factors, these are the people, that is what mine workers especially, they are the ones that end up having lung cancer. Because sometimes they're not aware, when you work with asbestos, nickel, chromate, benzene, all this, they can end up causing cancer. And people sometimes they're not aware of those kind of things. Social and psychological factors, it has already been found that stress is one of the most common factors that has already been found in increased cervical cancer. I know, especially with breast cancer, because somebody will have a breast cancer and then you ask, and the person has never had that in the family. And then it was found that stress is also has been implicated in increased susceptibility to several types of cancer. And then the other is a sleep disturbance, diet, or combination of factors may weaken the body's immune system. So we need to be very careful that cancer is not, we cannot get it. Certain things, social and psychological factors can end up causing it. Certain food as well can cause cancer. For instance, if you keep on eating or sodium nitrate when ingested form a potential of carcinogenic. Sodium nitrate is still being used because it is effective in preventing food poisonings caused by bacteria. Pesticides and herbicide residue, those are chemicals in food that we must be very careful, because sometimes what they do in the market, they use some of this to wash vegetables or to clean, to wash their fruits, and then you go home, you buy them. You also, when you arrive at home, you don't wash your apron, you just take it and eat it like that, and that can be dangerous. Hence, it's always been recommended that even if they can say it has been washed, I always prefer to wash it myself. Certain medical factors actually can also increase a person's risk for cancer. That is another DSE, which was used to control bleeding during pregnancy, but then it was found that it can increase risk for cancer of the reproductive organs. And estrogen supplementation and chemotherapy used to treat one of cancer may also. Sometimes you're trying to use chemo to treat a certain kind of cancer. Then from there, it also causes something as well. One has to be very careful with it. And one of the things that I don't like, I don't know whether sometimes the doctors, do they really educate a patient if a patient is going to go for chemo, so that the patient must understand what chemotherapy is going to do? Or they just said, no, you're going to go for chemo. They take it for right that you understand where they need to take the patient through the steps and explain. I will not talk about the viral because of the sake of time. And then in terms of the risk factor for breast cancer, I love this diagram because it actually shows what are those that we are we must be very careful. And one of the things that contributing, lack of exercise can also contribute to breast cancer. Excessive alcohol can also contribute to breast cancer. Deficiency of vitamin D also can contribute to breast cancer. Increased insulin-like growth factor. So these are the things that one needs to understand, that they are also the contributing factor for breast cancer. And one needs to be very, very crucial in terms of taking those kind of things. Well, how do they diagnose cancer? Most common method, they will do a biopsy where a small tissue sample is surgically removed and they examine it under the microscope for the presence of cancer. Or sometimes they will use the endoscopy, which is a flexible plastic tube with a tiny camera on the end and inserted into body cavity and organ, allowing physicians to view the suspicious area, which is now becoming common because technology keeps on changing. The other way that they will also use the diagnostic imaging, where they will use the MRI, magnetic resonance imaging, but this can also be very expensive. Or they will also use a CAT scan. The other time, what they also use, other diagnostic factor, they use the blood test. And some tumor releases a substance called tumor markers, which can be detected in blood. Hence, for each and every kind of cancer, we've got the tumor markers that can be used for that. If you want to test for prostate cancer, they usually draw your blood and they're going to analyze PSA, which is a prostate-specific antigen. However, prostate-specific antigen is not sensitive and specific enough for prostate cancer. It can be normal, then you end up having cancer. And I'm going to give an example because it was already in the media, so I'm not going to, everyone was aware that Desmond Tutu had prostate cancer, but his PSA was normal. This is where I'm talking about the specificity and the sensitivity of the PSA. And this was one of the things that has actually caused me, and making me to do research on prostate cancer. Another thing, higher than normal PSA level can indicate can indicate cancer. But in summary, PSA, especially for men, they cannot always rely on it if it's normal and thinking that they're not going to have it. So those are the blood tests and the markers that I'm just going to use. I'm going to stop with part one because this is where I was supposed to address a certain issue, and then part two is also going to come where we talk about the preventative measures in terms of that. I don't know if I pause here, if there are any other questions from part one, or what must I do in terms of that. So this is the end of part one, and I will continue with part two.
Thank you very much, Prof. Shirley. That was incredibly informative. Yes, you can end part one here, and we will definitely come back to you. I'm sure whoever's listening has lots of questions for you. If they can hang on to those questions for now and raise your hand when we go to the Q&A later, or put your question in the group chat and we'll try and get to you. But Prof. Shirley, that was incredible. There's an incredible amount of information about cancer that people don't know, and I think you've done an amazing job of showing both the social and psychological factors, and how you can prevent it in just your social life, and also the impact of stress I found really interesting. So I think we all need to watch our stress levels during this very stressful time as well. Without holding us up too much more, I'd like to move on to our panelists. We've got an incredible group of women to speak to you about their experiences with cancer. So I would like to start with Miss Rita Mpokwane. Rita, I'm going to hand it straight on to you. I don't want to give you too much of an introduction because I'm sure you want to tell your story yourself from the heart. So over to you. Rita, I'm not sure if you can hear us, but we can't hear you. So if you could maybe unmute your mic or give us an indication if you are still connected. Okay, unfortunately, we still can't hear you, Rita. Our technician sensor will help you in a second. So what we'll do is we'll actually move on to our next panelist, and we'll come back to you, Rita, if you don't mind. So our next panelist is actually Miss Lizanne Joe. And thank you so much for joining us. You've got a lot of things to say. You're a wonderful advocate in the space. You have a wonderful experience and knowledge to share. So we're really looking forward to all the knowledge you can share with us today. I'll hand it right over to you. Thanks, Lizanne.
Thank you very much, Sarusha. And thank you to Languni. Thank you to everybody. Thank you to Prof. That was really, once again, very informative. My name is Lizanne, and I'm going to share my experiences. I am a person that went through this path, fighting this battle, breast cancer. I was diagnosed with breast cancer 14 years ago. That sounds like very far, long time ago. But sometimes I'm not sure. There are days that I feel it's like yesterday. And then there are days that it's like so many years ago. But one thing I can assure you, it is something that visually never goes away, and also mentally. This month, of course, we pay tribute and raise awareness to everybody who has been confronted by this dreadful, fearful, and threatening disease. When I was diagnosed, I was lucky to actually kick this disease to the curb. But I'm not sure, did I? Sometimes I'm not sure because I'm just a human being. It was the hardest, most difficult time of my life. Maybe it wasn't really. I then refused to give up. But sometimes I do feel like I'm actually giving up. So you can see it's actually very confusing sometimes if you went through this road. When I was diagnosed, when they told me the result of the outcome of my test, there was something that literally died within me. In fact, I can't even explain the feeling that I had. But there was this small little light burning inside of me. And I'm sure today, in retrospect, maybe it was the light of life. But I know somehow I need to continue with life because I have 2 children. And that was my life. And they are my life still. Cancer has taught me so many things. Cancer has taught me that life is so unpredictable. When you hear cancer, the word cancer, it is immediately people think of death because society has decided that it's a death sentence. And it is not a death sentence. 14 years after that, I'm still here. But also, there is this word that people, when you tell them that I had cancer, then they say, well, you are strong. That is a word. Yes, maybe it's a positive word, but for me, sometimes it's just something so negative because I don't even want to hear that because you don't always feel strong, you have strength, you must have the strength to carry on. But the word strong sometimes feels that people are just patronizing you so that you don't talk about it further and stop. So it's just my experience or my feeling. What I've also realized that the death, this being scared of death is really so unnecessary because it is something that we don't know. But as human beings, we are just that type of species that are scared of the unknown. So when I think of the path, the road, what stood out for me that time was how vain we are as human beings. My sisters, and I'm just saying women, the minute they heard breast cancer, they think of those 2 beautiful things on their chest that define them as women. And I think it's not because of we want to be like that. It's because how we have been raised by society. And for me, it helped me, this path, this road that I was on, that it is really not my physical appearance. It is about what's mentally going on. Coupled to that, cancer, breast cancer physically shows, but we need mental strength to get through it. And if you are mentally connected with yourself, then the physical appearance doesn't really count. But it is easier said than done. When I opted for chemotherapy, the doctor explained to me that, look, you might have certain side effects. And I always like to bring this into these type of platforms when I speak about it. So the doctor said, there's my daughter also. I have to mention it straight from Cape Town. Sorry. So I thought, okay, well, maybe I will just get a few of the side effects. But you know, life is very funny. It chooses me to, to experience everything. So when I say I experience all the side effects, from losing my hair, to losing my toenails, to breaking my teeth, to having mouth ulcers. So when I said it's a physical, you get physically vulnerable. And I was very lucky to have the support of my friends. On that note also, support of my friends, it was also very overwhelming. I enjoyed it, but there were most days where I felt like I don't need it. But how do you say that? Because in the end, you're going to need it. So it's confusing. But it has taught me so many things. It has taught me that life needs to be lived to every little inch that it can offer you. I learned to admire and to love myself. Sometimes I don't. I learned to laugh at my mistakes, because when I went through chemo, I had to laugh when I couldn't walk to the bathroom, when I had to crawl to the bathroom, because I had to find the humor in it. It also taught me that I am actually fortunate that I went through this experience, because who must go through this experience? If I feel that I am too good to go through it. I've also learned that it wasn't my fault really, because we sometimes want to take these things and we want to say, what did I do wrong? I learned that I did not do anything wrong. I learned that I must be grateful for the little things in life. And I'm grateful today that I am still alive to tell my story. I learned to understand the word strong, and I learned not to like the word strong. I learned to love my own company, and mind you, I felt so that word strong during lockdown, because I've learned that I've overcome a disease that we are all still scared of. But coming back now to, this is romanticizing my story. Today, when I wanted to write and to put something together, I was a bit not in the mood, because I feel it's my 7th time on this platform doing this, but what impact do I really make? Is it really only my responsibility as a person who overcame breast cancer to just do something and speak about it and motivate people? My friends, where are they? They are just saying, you're strong, Lizanne, but what do we really do? And I think we need to take, and I want to challenge us, myself, when are we going to take a revolutionary step when it comes to breast cancer specifically? When am I going to be a real activist for breast cancer? We in this pandemic today, what are the breast cancer survivors, the people that are affected? How are they going through this? And then we are not talking about motivating them. In terms of finances, how do we cope at work? Do we get the leave that we're supposed to get? Do people still put people with this disease, with breast cancer and other cancers in the same category, give them the same amount of leave days? Do they deduct from them? Do their leave run out? What happens? Politically, where am I after I've been an activist politically working for the rights of people and then I get this disease? Where's my comrades? Economically, businesses. I am not only a survivor of this, of breast cancer, but where do I stand? What do I contribute towards the economy of the country to then make a contribution towards breast cancer as such? And I want to conclude. My message today to everybody is, live your life consciously to the fullest. Remember, and this might sound like a cliche, remember your life is your story and you need to write it very well, but you also need to edit it often because we live in constant change. Unfortunately, we can't control what happens to us, but we can control the way we handle it. Thank you.
Lizanne, thank you so much for sharing all of that with us. That is incredibly powerful. Not just sharing your story, but sharing your lessons from it and sharing those powerful motivational calls to action for how we can support others in this time. It is really, really motivating and inspiring. Thank you so much for that. And you brought up something really important that maybe we can talk about later in the Q&A is how people see others with cancer, which leads to issues of stigmatization, which we're really working to work against. I think we have Ms. Rita back online with us. So Rita Mpokwane, who would also love to share her personal story with us. Ms. Rita, if you are able to work your microphone now, I'll just hand it straight over to you. Thank you very much. Okay, I'm still not hearing you, Rita. If you could try and mute and unmute yourself one more time, and we'll have one more go at it. Handing over to you. All righty, technical difficulties. Sorry, everyone. Ms. Rita, we'll try and come back to you again in the after the next panelist. We'll move on to our third panelist then. Hopefully, we can get Ms. Rita's microphone to work on the next round. But I'd like to hand it over to Ms. Lisa Mokazi, who actually has a wonderful story as well to share, a very personal story and a very important one. So Lisa, I'm going to hand it straight over to you. Take it away.
Here I am playing around with my video. Thank you, Sarisha. It's actually overwhelming having to have a conversation or share my experience after Lizanne, in that fortunately I didn't get to go through what she's gone through in terms of breast cancer itself. With me, it was actually what I call a 12-year cancer scare. So I found a lump in my breast about 12 years ago at the age of 18, and immediately went through to the GP to have it checked out. GP had a look at it, referred me to the hospital to have some tests done, and she came back to say that it's benign. At 18, she then advised me that, well, you know, if you'd like to keep it, you may. Nothing should come of it. However, if you'd like to have it removed, you can do so too. So then I opted that, well, if really it's not going to affect me in any way, then I would rather keep it. Wow, bad mistake that was. But anyway, I continued with it. It really didn't affect me in any way. And it got to a point where after a few years, it disappeared. So then I thought I was in the clear. And then again, after maybe a year, it then returned. And when it returned with a vengeance, in that I I could now, depending on whether or not I'm on my periods or whatever's happening with my hormones, I would either feel pain in my breast, and it was a pain that would travel or move from my breast to my under armpits, if there's such a thing. And finally, when I thought, well, I should actually have this checked out again, I went back to a different GP. We ran through all the tests again, and he said, well, it's benign, and he prescribed me with pills to say, it was pills that were to help me with my pain whenever it occurs. I then asked him again, do I have to have this removed? Because in actual fact, at that point in time, I was in a better position to have it removed. And he said, no, not to worry. If you don't want to, you can keep it. But if you really do, then you may go ahead and remove it. This was a bit of a challenge for me in that obviously this would have to go through a medical aid. So if, the doctors are saying it's not crucial or of the utmost importance that you remove it, to have to then motivate to a medical aid why I have to remove it, it would probably not go through and they wouldn't pay for it. So then I decided to keep it for a bit longer. And I actually got to a point where I was used to it, and I could tell, depending on whether I feel pain or not, if I'm going to be on my periods and so forth. So finally, about a year ago, and this is after going to countless GPs, being booked in at some point to have this tested and having a biopsy done, that I eventually fell pregnant and had to go to a gynae now to go through my pregnancy. And when I explained the story to her and that I've got a lump, she almost had a heart attack, and she couldn't understand why had I not had this removed before. And it just goes back to what Professor Shirley was mentioning, that, sometimes the advice that we're getting from doctors in terms of, guiding us on exactly what is the right path to follow or weighing all our options is not necessarily the best for people who have got so much power over your life, and it actually should be guiding you through, certain stages in life. So she then told me, well, I would have recommended that you had removed this a very long time ago. But now that you're pregnant, we can't do anything with you. We're just going to have to go through the emotions and just monitor it. I went through my whole pregnancy, gave birth, and then finally I had to breastfeed. And within a week of having this bundle of joy who's just eager to be, nibbling at me and getting his food, the lump that was not a problem before and I'd gotten so used to it, literally it just grew in size to almost 10 times the size of what it was before. My breasts were swollen. I couldn't do anything. It was a struggle to breastfeed my baby. It was just a painful experience, to say the least. So I promised myself that once I'm done with breastfeeding, or actually that got treated, so that was fine. And I promised myself that once I'm done with breastfeeding, that I would actually have the lump removed. But again, I don't know what it is with us people. We know there's something wrong. We know what we're supposed to do, but yet I don't know, you always wait for the worst to happen, and then only do you actually go and have your problem resolved or looked at. But I still stalled a bit after breastfeeding. And then COVID hit us. So then I used that as an excuse to not have it removed. And then after COVID, it would actually sound so vain now, because really, I should have, you would think that more would have moved me to have it removed. But they announced the death of Chadwick Boseman. And it was something completely unrelated. I mean, well, considering it was colon cancer, he's male. So really it shouldn't have affected me, considering that I've come across many a Lizanne and many other women that have had a breast lump or have gone through my experience, and you would think that would motivate me. But no, it was the actor of Black Panther who moved me to, you know what, I need to get back to the doctor. Besides, if it could happen to him, it's also, I've got a son that I need to live for, and I need to get myself checked and have this thing removed. So eventually I went back to the doctor, and this time I found one who we were aligned, and they agreed with me that, you know, this is actually something serious. You've been so fortunate to not have had it progress into anything else, considering that, yes, they've all advised that it's benign, but it doesn't necessarily mean that it could permanently remain so. So he then organized to refer me to a surgeon, and literally in a week's time, I had a 12-year lump removed. I don't even know how I'm still in shock as to how it was removed. It was a successful treatment and everything, but yeah, it was interesting. I wasn't aware I was going to be put under. I thought I was just going to go in, they would just do a nice little cut and then whip that thing out. But I was put under for maybe an hour or two, and to then get out of that room and then know and feel that this thing is gone was, I don't know, I'm still trying to get my head around it. But yeah, so again, not fortunately blessed that it wasn't as terrible and got to that point of Lizanne. But just as she mentioned, I'm a mere human being, and all of us are, and we don't know what our future holds for us. You know, Professor Shirley has gone through the symptoms, the preventions, the cures, but really we don't know. And if anything, I'm just so happy. I think on the day I had it removed, or I think when Refilwe posted something with regards to breast cancer awareness, I put there on my status that I am now lumpless. And no one really got what I was talking about, but yeah. My lump is removed, and you know, I'm just crossing fingers that I never have to go through that ordeal again, and that it's the end of the story for me.
Thank you so much, Lisa. And first of all, let us congratulate you for being lump-free. That is excellent. And it's such a relatable story as well, such a long story. And I think a lot of us listening can say we completely understand that fear factor, that just not me, you know, just like sort of put it to the back of your mind. And that's why I love the way both you and Lizanne brought it back to Prof. Shirley's presentation of things you should look out for, destigmatize it, be aware, be informed. There are things you can do in your life to make it better. And then when you find that lump, go and have yourself tested and act on it. And we're happy it turned out for you. But thank you so much for sharing that with us. That was incredible. I'm going to try Ms. Rita Mpokoane one more time. Rita, I see your camera popped on. So I'm just going to see if we can hand it back over to you to see if you can give us your presentation. Thank you. Okay, one last time. If Rita, if you could try and switch your microphone on and off, and we can see if we can maybe reactivate it for you. All right, we seem to be having some technical difficulties. Don't worry about that. We'll try and get back to Rita during the Q&A session later. So hopefully we'll fix the mic problems by then. In the meantime, perhaps I could come back to you, Lisa, for just a second. We also wanted to talk about, Lizanne mentioned it a little bit, support for cancer survivors, and especially during your 12-year process. Did you feel like you had support, not just in terms of people who knew about it and had support for you, but also, Ms. Rita, is that you?
Hello, yes, hello.
Okay, Lisa, I'm going to put a pin in there for 1 second and we'll come back to it during the Q&A. Ms. Rita, I'm going to hand it over to you. Go right ahead with your presentation.
Yes, good evening to everyone. My story is I was diagnosed in 2009, and I went to a general practitioner where he sent me to a hospital. But I struggled to get a good doctor because I went to several hospitals in Pretoria. Because when I went to the hospital in Pretoria, they just told me there's nothing they can do for me. I must go home. Then I proceeded to another hospital whereby they also told me the same thing. Until in 2010, I decided to go to another province, whereby I went to that hospital, it's Tepong Hospital, whereby I got a doctor, and then they did a biopsy, all the procedure, and then she confirmed that I had breast cancer. At first, I was very scared because, as you know, we Africans, when we had a weight cancer, it means we are going to die. But luckily, I was strong because of my late mom and my son, who supported me in this journey. I removed my breast. I did a mastectomy on my left hand. Then when it comes to taking a chemo, I came back to Pretoria where I get my chemo. Reason being, I was scared to die far from home. You can imagine. And my chemo was done here in Pretoria and my radiotherapy was done here in Pretoria. And after my treatment, after a year, I opted to do a reconstruction, breast reconstruction. So my journey with chemo, it was very bad. I never had sores in my mouth, as people say, but when I came back from my chemo, I couldn't walk, I couldn't eat, but the following day, I was as active as a bee. Up to today, I'm healthy, and I like to tell people that are next to me about breast cancer you must always know your body. You stay in front of the mirror, you know your breast. That's the solution for me. That is my story. I thank you.
Thank you very much for sharing, Ms. Rita, and I'm very glad we got you back on because that was such an important story to share. I wonder if I can do a follow-up question. Do you think there's enough support for cancer survivors? You mentioned that the chemotherapy was quite harrowing, but you were back at it the next day. Do you feel like you needed the time, or there was enough support given to you after your treatment to cope with this? We may have lost Ms. Rita again until we get her back. Lisa, I'll come back to you again if you don't mind. It's sort of the similar question regarding support for survivors. We were talking a little about it before. Such a long journey for you, 12 years. Do you feel like you had enough support, both from your colleagues who knew about it and your colleagues that didn't, and your community as a whole?
Okay. Personally, I don't think so, and I don't think it's anybody's fault, and I don't think anybody could do better, only because it's only you can feel it. And even with myself, I mean, there were times where I would forget it. And funny enough, I'm not even sure if I can even mention this, but if you're with a partner, the partner can feel it too. So, I mean, you would think that something would click in their mind too, to say, well, you've got this, go do something. You would think they would encourage you or motivate you. So no, no, I don't think there's enough support. I actually even think the best support or assistance you can get is such programs and platforms. I know Lizanne mentioned it earlier on, that it's kind of a burden. She's kind of undecided about it. She's in between whether should she be doing it. Is it really reaching the people? And if anything, in answering you and actually answering or responding to her, it's yes, we have to do it. Platforms like this, when I went through them, were what pushed me to go back again to the doctor to have myself examined again. It's these platforms that reminded me that there's something wrong with me and that I need to have it fixed. And had I not even known that there was something wrong with me, it's these platforms that help you, or platforms that help you discover that there's something wrong with you in order to fix it. So generally, was the support there? No, but yeah, well, it's through this, it's an indirect support system that actually helps you to have the problem resolved.
Thank you, Lisa. And I think it's very important what you said, and also what you said before during your presentation about when Chadwick Boseman died, unfortunately passed away from cancer, it really drove it home that cancer can affect anyone. And I think it's not unrelatable what you felt as well, that, and it also brings into context how important these conversations are for us to all share our stories. So then everyone knows it can happen to anyone, and there are things you can do with early detection and early treatment that can really help yourself and help you recover, and maybe build your own support system and support system for others around you. And thank you for sharing that. And with that, I'm actually going to take us back to Prof. Shirley for a minute, who's going to go into some of the measures that can be taken to prevent breast and prostate cancer, because we can't forget prostate cancer. It is also very important for us to talk about it. And how do we actually conduct the self-assessment? Because we hear that a lot when we go to the doctors. They say, please continue with your self-assessments, but we're not sure what that means. Prof. Shirley, could you clear that up for us, please? Over to you. Thanks.
Thank you so much. Can you guys hear me? Can you hear me?
We can hear you, Prof.
Okay, thank you so much. I'm also going to tell measures to be taken to prevent both breast and prostate cancer for now, but this is actually mostly for cancer. And this is just going to be the outline, the prevention measures, avoid terminal cancer risk, and the new hope in cancer treatment, because I just heard one of the survivors mention that they really need treatment in terms of treatment in terms of cancer. So in terms of prevention, the primary prevention, what we need to do, avoid of exposure to cancer-causing agents. And people are not aware of certain, learn to read, even when you use your cleaning stuff. Read what is written. This is very important. Some of the cleaning stuff, you're not even supposed to use them in your household because they are carcinogenic. They can cause cancer. So example of tobacco, industrial carcinogenic, and I'm giving an example of cleaning stuff that sometimes you go to other people's house and you realize that what they are using, they're not supposed to be using it. So learn to read, because it's very clear what is the content in whatever you are using to understand, because they always mention that it is carcinogenic. Early detection of cancer is crucial, like how they would just been saying, where you have to go for a checkup, you have to do your pap smear, you have to go and do your mammography. That is crucial, is very, very important. Education is needed to promote early diagnosis and screening, and we've already got them, and even technology keep on changing in terms of that. We've got the imaging diagnosis, we've got the lab tests that they need to do, we've got the mammogram that people need to do. This is the gynecologist so that they can check the pap smear. Men go to the urologist. It's very, very important. The very same way that women always visiting the gynecologist, men must also do the very same thing, visiting the urologist. Genetic testing, this test can check for certain inherited genes, changes that increase the chances of developing cancer. For those families that they know that they've had cancer before, it runs in the family, this is when they have to start doing genetic testing. It is the Lancet laboratory, they can do genetic testing so that you are aware that you had it. Nowadays, when we give birth, make sure that they can keep that cord. Don't go and throw it, because usually that's how we used to do. More especially if you know that your mother or whoever in the family was suffering from any kind of cancer. When you give birth now, this is where you can use that cord blood. You can ask them to keep it, because this is where you can do genetic testing and it can assist in terms of that. For prostate cancer, there is a thing that they call it digital rectal examination. Although it might be a bit uncomfortable, but it is not uncommon. So this is what men always has to do when they visit the urologist. They're going to do digital rectal examination. This is during this process, what the doctor will do, they will insert a finger into a rectum and to feel around for bumps or hard spots on the prostate, and those that could indicate cancer. And because we are adults and people can also be aware whether with your partners, immediately you start touching that whatever, you start touching those balls, and then a person can scream, then there is a problem. That's where now you as partners, you can even test one another when you are, enjoying yourselves there. That is also another way that you can see from your partner, as well as they also play with the woman's breast. That's the way that they can also use in terms of testing one another. Avoid carcinogens at work, and especially in the workplace. For those working in the mining, there's this chemical that they call it arsenic, and that can actually cause either lung or skin. And I've mentioned that benzene can cause leukemia, chromium can cause lung cancer, and I mean, I've just mentioned the wood dust, furniture manufacturing, those can also cause nasal cancer. And a lot of the people working in this kind of industry, nobody is educating them that don't do this or take care of, and they need also to give you proper clothes to wear when you're working in this kind of environment that can actually prevent cancer. And I know that some industry they do, some industry they don't, and this is very crucial in terms of where are you working? Did they give you support? They also gave you proper a uniform that you need to wear that can also end up preventing this. As a scientist and where we're constantly playing in the labs and exploring things, there is a new hope in cancer treatment. And I guess because of South Africa is so slow to give us and to allow us to use stem cell to treat cancer. USA, they're already using stem cell to treat cancer. But here at home, SAPRA doesn't want to approve it yet. And hence, we take our cord blood and we throw it away. And that cord blood is actually a medication that can assist in terms of treating cancer. Remove cells surrounding tissues during surgery. That is now where the people have started doing immunotherapy. That is what they end up doing. Gene therapy, because a lot of people, they've got problems with chemo. So there are ways that they can also start doing cancer vaccine. People are now doing a lot of research in terms of to see whether they can have the vaccine. And if they can have the vaccine, that is also going to help, because with vaccine, it will build antibodies. And then the combination of surgery and radiation that can also be used. And hence, I'm voting for stem cell research and tissue engineering and regenerative medicine. And this is actually a hope. And I know that in the US per se, they are using cord blood. That's actually what they do. They use the cord blood and then they go through the certain processes and they use that stem cell from the cord blood to treat lots of cancer. And here at home, we're not allowed to even to talk about or to use stem cells because of the regulation that can be so hard, but and there is hope for that. And hence a lot of people that they've got money, when they realize that they can, if they realize that they're not getting any help, they fly, they go overseas, and then that's why they end up getting better treatment because of using the stem cell. So then in that note, I think now what I can just say to you, now, thank you so much, Laguni. What I want to say, you guys, you've been sitting there for almost 8 months or 6 months, so you can unlock your muscles after lockdown by getting yourself Ella Africa Sutha, which Global Health is manufacturing it. This is where now you can start now unlocking yourself, going and do exercises to prevent cancer. You saw when I was saying lack of exercise, now you don't have an issue, or you don't have to complain and say, no, I cannot go to gym because I'm so tired and I'm worried about the muscles. You've got a solution. There it is. Africa Sutha. If you want to order it, here you can place your order. There is my website. And on the cheerful note, I want to say thank you so much. Thank you for inviting me. I've really enjoyed listening to the survivors. I'm also learning a lot. And they also, for me, I'm learning in terms of what we need to do as scientists, as researchers. What was their experience? And on that cheerful note, I want to say thank you.
Shirley, that was wonderful. Thank you so much for that. So much useful information there. And thank you for giving us your website so we can also go and check out some more information. I see in the comments, one of our participants has commented that they didn't know about the chemicals and that they could be so dangerous. And I think some of us, even at the back of our minds, know chemicals are dangerous, but we don't know what to look at when we're looking at those ingredients. So thank you so much for pointing out how dangerous it can be. I think we'll all be a lot more vigilant in the future. I wonder if I could have a quick follow-up question with you. We mentioned self-assessments, and I'd like to maybe come to you first. If you have any sort of pointers or any advice for any of the people watching, what are some of the things they do when we talk about self-assessment? Could you give them some indication?
Yes, okay. In terms of self-assessment, for them, especially with the breast cancer, they can always start playing with their breast. Because of seeing if they wanna found a lump or something, or when they press and the white, sometimes there's a white thing that can come out and it's not common, then this is where they can also start looking at. And then that is for the breast cancer. But in terms of for the male, they can also start looking. That's what I was talking about, the balls or the glands, if they can call it. And then in terms of that, as soon as their partners start holding them and the men start screaming, that on its own, it is a sense of there's something wrong, because you cannot just scream like that if somebody is touching that, balls. So I'm talking to adults. I'm a scientist. I need to be open, and this is how it is. As I was saying, it's a two-way thing. The male can also do the self-assessment to the female, and the female can do the self-assessment to the male. That is how I was talking about. I'm referring to.
Wonderful. Thank you so much, Prof. Shirley. That is so wonderfully helpful. And again, I'd really love to urge everyone to check out the website that Prof. Shirley has indicated there for more information. I would like to open up the Q&A now. We've got just a little under 10 minutes to do that. So if you want to go to where it says participants and raise your blue hand, and we can come to you, or if you want to put your question in the chat, then I could read it out for you. But perhaps we can first kick off by, I think Ms. Rita's mic might be back on. So if I come to you first, Ms. Rita, and ask that question we were talking about before. Do you think there's enough support for breast cancer survivors, particularly as you explained in your story, that you were right back to work right after the chemo, even though it was so harsh? Could you share anything with us?
Yes, the solution with the people with breast cancer, they must join the support group. For people, because support group is for people with breast cancer. Because when you are at home and you don't talk to anyone, you talk with somebody who didn't undergo breast cancer, you'll get false information. And with our people, they like to listen to people from the street. They don't want to listen to us. That is why we must always have our breast cancer awareness, not only in October, but throughout the year.
Thank you very much. That is such an important point, that October might be Breast Cancer and Prostate Cancer Awareness Month, but we should be talking about this a lot more throughout the year. I'll share as well, a recent survey has found that particularly in Africa, and particularly in rural South Africa, that information around breast cancer treatment, screening, just regular information is not available for most women. And that is something we critically need to work on as a country and as a community. And maybe while we're still waiting for questions, I'm sure everyone's just getting warmed up. Lizanne, if I can come back to you, you do a lot of advocacy work. And based on raising awareness and spreading more information, so these women have access to just the basic information that will help them work away from stigma and get the right info. What do you suppose they can do there, and where can they go?
Unlike Rita, I'm not very much involved in those other platforms, but mine is more like the work platforms, like your different organizations calling me in for when it's Women's Day and those type of things. You see, all the workplaces do have your health and wellness units. But I think if people like us can maybe infiltrate that part of workspaces, for them to understand how important it is to take this part of womanhood serious. Because just today, this morning, I bumped into one of my colleagues in that specific unit, and I informed her about this session today. But I think we are, if you haven't gone through it, it's almost like it's still too far for you to understand it. So also being aware within the space, the working environment, because I think women suffer a lot in the workplaces when it comes to breast cancer, to deal with it, the sensitivity around it, the empathy around that. So for me, there's a really a lack there. There's a gap there in those spaces.
Thank you so much, Lizanne. That's actually a really important point. I hope we get a chance to talk about that a lot more, not just in this session, but in the coming months. It would be really important to address this and make this a more common issue. I see that Lisa has a hand up. So Lisa, if you want to ask a question, go ahead.
Yes, I hope Rita can hear me. So with my whole breastfeeding experience, after that gravity occurred and things are hanging. And there are times where I get over it, and there are times where I look at myself, and I promise you, I start bawling in tears because everything is hanging. So with considering Rita's story, I think she had mentioned that she actually had a mastectomy. And I'd like to then know that, considering if I'm in so much pain and hurt and, oh my word, I can't believe these are hanging, what then when you are told, what do you go through when you are told that we have to remove this to save your life? And how do you then view yourself once you've had it removed, knowing that, yes, you've saved your life, but it's also changed your structure as a woman and how you are defined as a woman?
It was very difficult for me to accept that they must remove my total breast, because knowing that without another breast, with only one breast, it's going to be difficult to walk on the street with only one breast. Because people, they judge you. They don't know what you are going through. So people must learn that if they see a lady with only one breast, they must admire that person. They mustn't judge the person because of he doesn't have another breast. Because there is a solution after breast cancer, after they remove your breast. You can do a reconstruction, but it's not immediately. They normally tell you that after a year, after you took your chemo and your radiation. I think I answered your question.
I think you did as well. Thank you so much, Lisa, for that question. Rita, for that answer. That is really so important. I think as women, we bear a lot of the brunt of a lot of these social stigmas. And here, particularly with breast cancer, we cannot afford to perpetrate those anymore. Thank you both for sharing that. I see, Lizanne, you have your hand up. Do you want to ask a question as well?
Thank you so much. Just in addition to what Rita was saying, I also went through that. But for me, it took me 12 years to consider reconstruction. And like she said, it is hard. But I think, like I said earlier on, Lisa, it is almost like we need to do a mental shift, in terms of looking at yourself and find yourself. It actually gave me time to really I had to find myself, to accept myself, hence I could go on for 12 years, literally 12 years. And I must mention that I actually became more adventurous at the time, like after, and I forgot to mention that, Sarusha, after the reconstruction, I didn't feel any different, After 12 years, I went through a reconstruction, that's like 2 years ago. And I didn't feel like I'm now prettier or I'm beautiful now. I still feel exactly the same. Sometimes I feel that I've lost my identity by after 12 years going you know, I'm not that power girl anymore because I'm now the same as everybody else, you know, just on the, like, you know, tongue in cheek. Yeah, but it is a journey. It is quite, it can be very, very difficult, but you have to work with your mental state. You have to, it's worse when it comes to your mental state. And once you can get there, then the road is a little bit easier.
Thank you very much for sharing that, Lizanne. And as you said, your superpower sort of is just getting through this year. So you said you hate the word and you love that word strong. And that is all of these important questions. I'm so glad you brought all of these up, all of these important questions and conversations that we need to be having. We actually do have a comment from one of our participants here. Tombi, if you want to go ahead and unmute yourself and ask your question or make your comment.
Good evening. Can you hear me?
Good evening, Tombi. We can hear you. Go ahead.
Yes. I was diagnosed on the 28th of August this year, and I went for an operation on the 20th September to remove the breast. I didn't know how to feel. It was just a short space of time. But as I was listening now to the letter speaker, that even after reconstruction, she still doesn't feel differently, or maybe not really happy about it, because really it's something artificial. And for me, I was just thinking, maybe when I have it, I'm going to feel better. For now, I feel that it's too early, and I really do not know how to feel. It's really confusing. It's an emotional roller coaster. I don't know what to think, not to think about it. But it is really challenging. I'm walking around with one long breast, and on the other side there is nothing. The strong word, yes, guys, the strong word really makes one want to cry at times. But I'm keeping it there, and thank you for all the information. Prof. Kio, really, for me, I can say, guys, I've seen on the presentation that one of the ways that one can get it can be maybe through stress related. For me, there is no one in my family. I can say yes, it is stress related. Thank you.
Tombi, thank you so much for sharing that with us. And we just want to wish you a lot of support, digital support, unfortunately, during COVID, but a lot of support and strength at this time. Thank you so much for sharing. I don't know if any of our participants or our speakers want to comment or say anything to Tombi. Just raise your hand or unmute yourself and go ahead if you do.
Can I say something?
Of course, Lizanne, go ahead.
Tombi, I'm very sorry, but welcome to the club. This is definitely a very, very difficult time for you. It's an understatement to say it's a difficult time for you. Remember, losing part of your body is not only about the physical thing, it's about you don't feel it anymore, you know, it's like that. But what I can advise you, if it can help, is to go through every emotion that you're going through, because no one can tell you to behave or to feel a certain way. And if you are not ready for reconstruction, you are not ready. You will know when you're ready. And reach out to people like us. We are here for you. And it's this type of things, you know, this time that we need to really hold hands. And you can get our information just to talk, because sometimes you don't need people to say something. You just need to share how you feel at the moment. And I can relate with you, but go through whatever emotion you're going through. Do not hold back. And I wish you all the best.
Thank you, Lizanne.
Sarusha, can I just add something? That
of course, go right ahead.
Lizanne actually mentioned a very, very important point by mentioning at work, the support at work, and wellness at work. Wellness at work, sometimes those people that are leading or in charge of the wellness center in a working environment, they hardly ever talk about cancer most of the time. And perhaps now is about time that we need to challenge them in a manner that we change all these things, because we now started to see that there is a need for the wellness centers and in the working environment to start bringing the cancer as part and parcel, because this is what is lacking. Hence, people end up trying to find support outside, and most of the time they were spending 8 hours, of their life at work, and then if their work situation environments don't have that, that is going to create a problem. And that's the reason why a lot of people end up taking the hearsay, not actually getting the right information at the right time, and they end up sometimes hiding it. So I guess this is where, and the stigma, of course, like how they've mentioned it, but I think the working environment, they really need to change a lot in terms of how, if they were now, COVID has made them to change, where there was a COVID team. And I think there must also be the same thing, the very same COVID team that was busy with COVID, must be the very same COVID team that cancer can also form part and parcel of that. And this is what is lacking, or is missing actually.
Thank you very much for that, Prof. And you're absolutely right. We don't hear these conversations in the places they should be, and it's definitely not enough support within these structures for women. And thank you very much, Ntombi. I think a couple of our speakers would like to offer you support offline as well, so we'll try and connect you there. And as well, one of our participants did also ask for Prof. Shirley's presentation. I believe Languni will be making that available on their website after this presentation. So yes, you please do follow up and get more information from that presentation and from Prof. Shirley's website. Remember as well that you can go to cancer.org.za to get more information as well. And as many of our speakers have brought up, and Ntombi, it's very important for us to support each other, to be advocates, and to be very vocal so that we get these conversations happening in the right spaces. So thank you everyone for participating. I'm going to hand it back over to Fariso, who wants to do the closing for us. And thank you again, Languni, for having this important conversation and hosting us. We are very grateful for this space and the opportunity. Thank you.
Hello.
Hello.
Hey, Fariso, there you go.
All right. Good evening, everyone. Thank you for attending, and very informative night. And I still have goosebumps from the presentation and from everything I learned today. I would actually like to thank our moderator. You drove the whole session very well. Thank you so much for being available and being part of our team. I would also like to thank everyone from the panelists. Ladies, you're amazing, and continue sharing your stories, and we really appreciate you agreeing to being part of our team. And as well, the participants, thank you for our audience, actually. Thank you for attending. And if you go after this webinar, we will have YouTube video of the webinar. You can find it on YouTube, and on our website we will have more details around the panelists, and you can also get the contact details if you want to connect with one of the panelists. And that's it. Thank you. Enjoy your night.
Thank you. Good night, everyone.
Thank you.
Thank you. Good night.
Good night.
Good night, and thank you so much, ladies.
Don't be sending hugs from every corner.
Thank you. Bye.
Bye.
Bye. Bye.
Bye.
Bye.
Okay.
I'm always the last to leave, so don't worry if I'm just hanging around here.
Bye.
But it looks like a number of people left. I wanted to.
I'm trying to leave.
Ntombi's still there.
Hello, Ntombi. We see you're still here. We have Ntombi's contact details so we can connect. Okay, Ntombi, we do have your contact details. Thank you so much for sharing. And we'll definitely put you in touch with the right support. And thank you so much. We really appreciate it. Have a great evening.
Team, Farisa just went offline again. I think it's her, Rita, and Prof. Shirley. I think it was basically a word of appreciation, but then I see they've actually left. So
Okay.
yeah.
It's dinner time. It's dinner time, Senzo. Senzo, thanks to you for your magical magician behind the curtain work with all of that. Much appreciated.
Yeah. No, thanks for holding the fort down, man. I think you held it down very well, especially when we had the glitches.
No worries. I think I'm glad we got everyone to speak. I was really worried we'd miss Rita, but that went all right. Thank you, everyone.
Thank you so much, Sarusha.
Thanks for inviting me. Whenever you need anything, you know where to find me.
Definitely. Definitely.
Thanks, love.
Thank you so much.
Thanks, guys. Have a wonderful evening.
Okay. Bye.
Bye.
Are we all leaving?
Yeah, I was hoping that we were gonna have like a last discussion, recap of what happened and everything.
Yeah. Maybe we can do it on WhatsApp.
Yeah. Okay. All right. Sharp.
All right, Sean.